picture a sponge, fill it with bacteria, and then take a whatever and make a big hole in the middle of the sponge. When we do a root canal, that's what we fill. All those other little holes in that, those are just bacteria hotels forever. Now, I know some of you have been on Facebook and have asked me questions about this, or different types of material to use to sterilize a canal. Someone has a holistic endodontist who does it a brand new way, and they're perfect and they're wonderful. It's not true. There is no way you can sterilize a tooth. Here is a picture of a microscopic view of a tooth. You can see the main canal and 18,000 million little holes on the side, which, by the way, turns out, if you took them out and measured them, would be roughly 3 miles of tubules per tooth. And there's no way that we know of that we can sterilize that. So what does that mean in practical conditions? It means that if you have a root canal in your mouth and you're not totally super healthy where you're leaping tall buildings, you have a problem, because that level of toxicity that's coming from the root canal is going in your system and is weakening it. I posted on some of the cancer sites that I was a holistic dentist practicing over 35 years, and would strongly suggest that you remove your root canal teeth and your mercury fillings because they're toxic and will weaken your immune system. One more thing I want to mention is Weston Price. They did a lot of work with root canals in the 20s, and he found that patients who had root canals were getting sicker more than his healthy patients. So he did an experiment. He would take the tooth out on someone, grind it up, and inject it under the skin of a rabbit. And if the patient had kidney disease, the rabbit got kidney disease. If the patient had heart disease, the rabbit got heart disease, and so forth and so on. And what he decided was that root canals are spreading toxins into the rest of the body. It's called the focal infection theory. It was immediately put down by the American Dental Association. And it wasn't until 1996 where the chairman of the Eastman Dental Center came out and saying, we need to really look at old ideas, because just because it's old does not mean it's not useful. And even though today root canals are still being done with great frequency, and the American Dental Association will tell you that they're great, all the slides that you're going to see on this lecture are from endodontic departments in all the schools around here. So this is well known, even though it's not thought about very well. It's just odd to me that they would do studies showing that these things are definitely toxic and then say, yeah, it's fine for you to have one. I hope you enjoy the lecture. You'll get a lot more information. Hi, I'm Dr. Victor Zeines, and I put together this video series because I wanted to give back what I've gotten my whole life. And I wanted you people to look great, lose weight, have a long and healthy life. And I think this series of videos will help you do that. So what I'd like from you in return is for you to like and subscribe to my channel, because that's the way we get more people coming in. The more people we come in, the more lectures I can give, and the more question and answer periods I have, because I'll have more time. So once again, please like and subscribe to our channel if you like these videos. And I'm thanking you in advance. Once again, have a long and healthy life. Take care, folks.